Stress, anxiety, and depression are skyrocketing among children and teens, and Cook Children's healthcare system is on a mission to bring these topics into the light. I'm Winnie King.
And I'm Dr. Kristen Perch. If you have kiddos in the room, now is the time to put on those headphones. Some of the topics we'll be discussing will not be suited for young ears. This is Raising Joy. Welcome back to Raising Joy. This is a good day.
Yes, it is. Tell me why.
Because today we're going to talk about one of the most important subjects in mental health, and it's one that affects all of us.
You are so right about that. Today, we are lucky to have Dr. Dawn Hood-Patterson on the show. She is the program manager with the Center for Children's Health, led by Cook Children's.
Dr. Hood-Patterson graduated with her Ph.D. in pastoral theology from Bright Divinity School at Texas Christian University. Her main area of research and writing involves adverse childhood experiences, or ACEs, which is what we'll be discussing today. Welcome, Dr. Dawn Hood-Patterson.
Thanks. Thank you so much for having me this day. And it's such a joy to be with you.
It is. It's a joy to have you too. What are some examples of adverse childhood experiences, or ACEs as they're called, and why are they so important?
That is a fantastic foundational question. So ACEs came out of a study from the 90s that was done by Kaiser Permanente and CDC, and they identified 10, what we now call the classic 10 ACEs, which are related to child abuse and neglect and what they call household dysfunction. And so there are 10 identified ACEs that came out of that study. And the reason that ACEs are so important and so foundational for some of the things that we think about in healthcare, both physical and mental healthcare, is that they have a really long-lasting impact on a person's health. So when I say person's health, I think about both the physical health and the mental health of a person. And so some of the examples of some of those classic ACEs are things like physical abuse, sexual abuse, physical neglect. But then the things that fall into the category that they deem as household dysfunction are things like divorce, or a relative has been incarcerated. And one of the things that I want to mention is that those are the foundational ones, those that are associated with that particular study. But as the research has emerged, we are finding that more and more things that are adversities to people are also linked to poor health outcomes. And so when I say poor health outcomes, of course, there's the mental health aspect, but then it's linked to things like diabetes or heart conditions. So it really does have a tie to many aspects of our lives.
I read that study by Dr. Folletti whenever I was in residency, and there are a few times whenever you read something that it really changes the way that you see the world and your practice of medicine. And for me, the ACEs study is the top most important study for child psychiatry, just to understand the role that trauma has on childhood development. And unfortunately, we see a lot of that. I see a lot of that in my practice, and also on the inpatient unit and things like that, because as you may guess, kids have a lot of thoughts and feelings about like being abused, neglected, or living in a house where they don't feel safe and secure. So I'm just so glad that this is an area of focus that's being addressed by Cook. That makes me really happy.
Yeah.
I mean, it's funny though that you say that these things, these basic fundamental things are ACEs, because I would have never thought, okay, divorce. Who hasn't, who wasn't, doesn't know someone who's dealt with divorce? And I come from a different generation. So my generation is like, take it on the chin, swallow it and keep going, keep moving. So you don't think about, divorce is something that could have had a problem in my health. I would have never thought about it. Yeah, it was traumatic when it happened. But as time goes on, do you not forget it and keep on going? I mean, what is that? What is that?
Yeah. So you named a couple of things that I want to highlight. First is that there is a really strong prevalence of ACEs among the U.S. population. So it's estimated that about 60% of people experience at least one or more ACE or adverse childhood experience. So it's really common to come across people who have experienced an ACE. The other thing that you mentioned that related to divorce, so emerging research is showing that, well, there really is a debate. should divorce still be considered an ACE? And so a lot of people say, yeah, it really should, because it is that impactful on the life of the person who's experiencing the divorce, or the family, the people who have either been separated or the people who are experiencing the separation. And then there's some others that are now saying, well, maybe it's so common that it shouldn't necessarily be classified as an ACE. And so there's a little bit of debate out there in the
Right.
research. And so I generally like to say, this is the debate, and I'll let you kind of think about how that might have implications for your practice, but also for just your life in general, if
Right.
you're experiencing a divorce or separation.
Right.
Because separation's another aspect where it's not necessarily classified as an ACE, but some experience it as a really fundamental altering situation within their lives.
Right. I mean, I can understand the mental and the emotional, but then to think that it may have an impact on my health and my outcome, the outcome of my health, it just does not. It just would not have. I wouldn't have thought of that.
Yeah, I think that that's why you mentioned that it's so foundational to the way we think about how we classify health. It really changes the way that we think about this has implications for, my physical health moving forward. And then, like you said, obviously the emotional and mental health.
Right. Right.
And what they found in that initial study with Dr. Folletti was that these adverse childhood experiences, really, those, I think it was 6 or 7 that they had about the abuse or the neglect, or living in a house where there's substance abuse,
Mhm.
those sorts of things. It leads to, as you become an adult, to engage in more what I call kind of like buffering
Mhm.
activities to kind of help calm down that stress. Because I think having those adverse experiences in your childhood causes you to be stressed more easily. And so you engage in activities that help you calm down. And not all of those are good for your health. So there was, if you had one of the ACEs in your childhood, you were more likely to engage in smoking or in
Drinking.
drinking.
Okay. Yeah.
And because I remember when I read the study initially, I was like, how does abuse lead to an increased risk of heart disease
Mhm.
or of cancer? Like,
Mhm.
what is that connection? But it is through these,
The
like,
risky behaviors.
yes,
Got it.
it's
Yeah.
kind of through that, like, buffering that people do. Just, we all need to tune out at some point. And so but I think people who have had a trauma in their early childhood just have more of a need to tune out, because it does kind of affect your brain and how it develops.
Does.
Why is it
Yeah.
important to share our trauma? I mean, again, I'm saying I'm from a different generation. I'm baby boomer. You just squash it down, you keep on going. But why is it important to share the trauma stories, and how do we share them in a safe way?
It's a great question. So I am of the mindset that it's important to share our stories because it opens us up to be able to recognize things within ourselves. But there's something that's really compelling about sharing a story that makes us feel more connected to each other, and it allows us to not only realize that we have something perhaps going on within us, but then it may not be so strange. Like,
Okay.
we may be one among many that are that share in these trauma experiences. And I'm really mindful of the fact that when we start to share our trauma stories, the light around us
Hmm.
starts to help us understand ourselves better,
Hmm.
understand the world better. Um, it it's kind of healing.
Yeah. And you're not
To
by
share.
yourself.
You're not by yourself. And so that's the second part of your question when you ask, how do we do this in a safe way? I think that that's a really important question, because there can be some toxic ways
Yeah.
to relive trauma. But one of the really key aspects, I think, is to not do this alone,
Mm.
to not do trauma work alone. And so whether that's you have a really trusted friend, and when I say trusted friend, I'm talking about somebody who won't just let you off the hook easily, but
Hmm.
will actually help you kind of think deeply about the questions that you're bringing to the table, or will sit in there with you whenever it's a hard
Mhm.
conversation, who
Mhm.
won't give up on you.
Mhm.
So that's a trusted friend. But I also think that there are some incredible professionals, whether it's a professional who is in the mental health profession,
Mhm.
and there's some trained clergy. That's sometimes a place to go particularly if you're looking for services or looking for a place to share your trauma story that is free or
Sure.
cheap, because sometimes the mental health services are not covered by your insurance or something like that. But then also you can look toward community programs. So trusted community programs. I would really encourage people to investigate community programs to make sure that they have some good backing, some good training. But there are places like LGBTQ community centers that offer support groups. Again, communities of faith, so like an Islamic center or a church. And then actually in Tarrant County, there's something that's coming out of Commissioner Brooks's office. It's called Bouncing Back, Thriving Forward. And they're about to launch these community-based healing circles, healing groups. And it's trained professionals within the community that help support people in the community. So it's for the community, from the community.
Really?
Yeah. And it's these groups are on the precipice of launching. So they should launch sometime the summer of 2022. So that's kind of what they have in the works, and they're in the process of recruiting and training people who can help lead some of these community-based groups. So there are several ways that you can start to explore your trauma story, but I think the ticket is to not do it alone, not to camp alone.
Right.
I think you're so right. Just because when you think about these things happening in childhood, it's natural for kids to just believe that they caused it in some way, and that's just because of development. And but just to have an adult to say it's not your fault, I think is so important. And I think kids carry around a lot of shame and guilt, thinking that they caused these bad things to happen to them, and that's not the case. But I think a lot of times it takes a professional, a trusted adult to be able to tell them, "You did nothing to deserve this," and that can be a really powerful message for kiddos.
Yeah.
I bet you hear that though, Kristen,
Mm-hmm.
in your work with these kids.
A lot, a whole lot. And, on the inpatient unit, a big component is group therapy, where kids are sharing about their trauma experience sometimes if they're feeling safe and like they could actually get to a place of sharing. And whenever I see them in clinic, outpatient, I'll ask, well, what was the most helpful thing you thought from outpatient or from being in the hospital? And they'll tell me it's because I didn't feel alone. Because I felt like there were some people who understood why I felt the way I did.
Yeah, that's really compelling.
Yeah. And we know that you've been hands-on in addressing these issues here in Fort Worth. Can you tell us what you and your team have been doing to address mental health for parents living with adversity?
Yeah, we have a few initiatives here focused mainly in Fort Worth, but some extend to Tarrant County that are directly meant to address mental health concerns. So the first is something that came out of the ACEs task force, which is a task force that is community wide, and it incorporates people from different sectors. So be they local government or nonprofits, other healthcare providers. And we gather together to share resources and to talk about what are the big needs in the area. And we've identified within that because of COVID-19 and the pandemic, the isolation that it has caused, the fear of infection, it has exacerbated or made worse some of the experiences of adversity that people were living with before the pandemic. It's just kind of made it worse.
Yeah.
And so what we are doing as an initiative of that ACEs task force is to put together a caregiver education series. And so we are collaborating with what I'm calling the experts. And so when I say the experts, I'm saying those with lived expertise and those with clinical expertise, to bring them together to share their stories of mental health concerns. And so the lived expertise would be the caregivers, the parents who have had a child living with a mental health concern. And then that will be bolstered or accompany a clinical expertise. And these will be short videos. So that's something that our team is producing right now. We're helping to develop that training, recruit those experts, try to get all of that situated. So that's one of the things. The other thing that we are doing, particularly in the East Fort Worth area, is we have a program called Build a Bridge. And the purpose of Build a Bridge is to help community members get connected to medical and dental home. And so that means that we evaluate what sort of obstacles or barriers are there in the lives of these families, and how can we help them navigate those barriers and obstacles to get connected to a mental health, a physical health, a dental health practitioner.
We may have listeners who don't know if they have been affected by ACEs, because we talked about the little one, the little one, it's not little, divorce, and there are 10 that you mentioned. But how can they find out if what I've experienced is an ACE, and if that's something that I should be paying attention to?
So again, I would really suggest to lean into doing this in relationship with your healthcare provider. But there are some resources available online. I mean, you could actually go and take a quiz online and find out if you've been impacted by ACE. But ultimately, you can read the list of ACEs, and you can actually read a lot of these ACEs studies online.
Mm-hmm.
They're free and open for people to read more about it. But again, I would encourage people to go into community, go into a relationship with perhaps your primary care physician could be a really compelling person to speak to about this, and how the potential of an ACE has impacted your health. You might be going in to see them for a checkup, but you could ask them about, you know what, I'm putting some pieces of the puzzle together, and I'm wondering how this might impact my overall health.
Yeah.
And they could maybe get you going in the right direction.
Okay. Good.
You're doing such good work in the community. Like, we really appreciate all that you do, because I feel like there's not enough attention brought to these, childhood experiences that people grow up with. But why do you think this work is so important to you?
So ultimately, I really do believe that my research and my work comes out of kind of my own lived experience. So I have a history of trauma. I I grew up in South America, and when I was in South America, my dad was murdered in front of our home. And that was when I was 17. And when you're in the grips of something like that, because we had to be evacuated from the country. And
Wow.
so I didn't finish my junior year of high school. So no one tell anybody. But
You have good reasons.
yeah,
Okay.
I have decent reasons. But we had to be evacuated from the country. So there are things like some really dramatic losses, not only the loss of my father, but the loss of my home,
Yeah.
of the country that I kind of had grown up in,
Right.
and the culture surrounding that country, loss of friends. And so to kind of pick up these pieces and move to a new location, I did not do that alone. I did that with a network of support around me. So I had incredible clergy people who
Wow.
supported me.
Wow.
And then my mom is,
Aw.
I mean,
She's your mom.
but she's my mom, but she's also a really cool person.
Okay.
So she gets like an extra notch on the mom
Okay.
belt.
There you go.
So just recognizing that these sorts of situations are not navigated individually, and then having really strong people around me. And by strong people, I mean people who help me identify that there's nothing that I did to cause certain things.
Mhm.
And then also help me navigate and be okay with the grief that accompanied
Mm.
some of these experiences. I had a clergy person who let me just be really messy for really a long time.
Really?
And just let me question all the things that come up, like question my faith, question my new identity, question how I make purpose or meaning in my life,
Yeah.
and just sat in with me, just let me do the messy
Wow.
with me. And so I think that's where finding those really trusted people is really compelling and impactful. And that's what motivates me not only to do the work that we do in the
Mhm.
community.
Yeah.
I'm part of a team that does some incredible work, but also it challenges me to do research differently. It challenges me to ask questions differently. It challenges me to think about what it means to be human, and get to some of these like really foundational questions about what it means to be a shared human in this space.
Right. Right. And you went through that. And your mother, as you gave her credit, was very helpful in your processing and dealing with it. But she probably had to process and deal with it as well. So she could help you. So how do parents and how do caregivers begin the work of processing their own trauma
Mm.
so that they can deal with whatever their kids are going through?
So that's one of the things that I think that's why she's not just my mom, but
Yeah.
she's like an exceptional person. So an example of that would be that she, again, did not try to do that herself. She sought professionals to help bolster me because she, like you said, she was experiencing her own sense of grief and loss related to the things that our family had gone through. And so she knew to turn to people in her life to help her help me,
Mhm.
and I think that the other thing that parents could do is not only equip their children with good people around them, good professionals, good trusted adults
Mhm.
around them, but also recognize that we can we can have an experience of trauma, but each person who's experienced that moment of trauma experiences it differently.
Yeah.
So she lost a spouse.
Yes.
I lost a father.
Right.
And so yes, we are grieving the same person. We've been traumatized by the same event, but she experienced it differently than I did. And she allowed me to exercise my grief in the way that I needed to.
Right.
And then she put some kind of boundaries around that. So whenever I would act out because I was angry or just really I was not okay with
Yeah.
with what was
Yeah.
happening in life, she put in boundaries. She said, "Okay, your curfew is changed because you are breaking the agreement."
Mhm. Mhm.
And so she kind of helped put um, protective factors
Mhm.
around me to kind of make sure that I didn't get too far off into the weeds.
Right. There's still structure.
There was structure.
Right.
And
Yeah.
I think whenever a kid is struggling or grieving, I think sometimes parents get afraid
Yeah.
because they feel like they're walking on eggshells. And so they don't want to push too far. They don't want to challenge their kids. But I agree with you that having those limits helps kids feel safe.
Yes.
And I think parents often they get scared of it. They're like, I don't want to like re-traumatize my kid.
Right.
I want them to know they can come talk to me. And I'm like, be consistent.
No.
Be consistent. Like show them that you love them through the boundaries, that you love them enough to make sure that they're safe and that they're doing what they need to do to take care of themselves. So
Yeah.
I totally agree with you on that.
That's so important. I mean, and just everybody dealing with it. It's just so incredibly important, and how awesome it was that your mother she knew how to handle her relationship, like you said, with your father was different. It was a different relationship.
Yeah.
So her trauma was different, but still
Mhm.
dealing with it and still recognizing that when you are acting out, you may be acting out because of that trauma and
Yeah.
not because you're just a bad kid.
That's right.
You're acting out because there's something there. And she recognized that. How awesome.
She did. She recognized that, yeah, it was something that happened to me. It was not something about me
Right.
that was causing me to maybe act in a way that was not normal for me.
Unacceptable.
Yeah. Yeah. And I think the other thing that she did really well and she demonstrated well was that she took care of herself.
Oh.
So, as a parent, and I just reflect on, I'm sorry, I'm not a parent, but as I reflect on her parenting, I'm just really mindful of the fact that she made sure that she had people around her to help her
Mhm.
as well. So she was not only looking out for me, but she was looking out for some of the things that she needed to take care of and look out for herself.
Now, did you have siblings in this situation?
I do. I have an older brother.
Okay. So he was dealing too.
He was, yeah, he was at college when it happened. So
Oh.
he was here in the US whenever it all happened. Yeah.
But still dealing with it in a different way, even
That's right.
even a more different way, because he
That's
wasn't
right.
right there, but still trauma nonetheless.
Yeah. And so yeah, he's a lovely person too, and yeah, but absolutely impacted by it as well.
Yeah. Wow. That's incredible. Well, thank you so much. I mean, this was informative. I know I'm dealing with ACEs. I got to go back and look for mine. I got probably about 3 or 4 of them that I'm doing adversely and not really dealing with very well. Thank you for coming in.
Thank you for having me.
Yeah, we appreciate your time. And to our listeners, if you want to learn more about adverse childhood experiences, we have a lot of great information at checkupnewsroom.com.
Yeah. And if you and your child is struggling, please know that it's okay to reach out to a licensed professional, a counselor, someone in your area, or a physician. And if you get a chance, please take the time to rate and review and subscribe to Raising Joy.
Have a joyful day.